6 key symptoms of hMPV virus as China sees COVID-like spike in cases. Health experts have issued advice on the symptoms of human metapneumovirus, which can be serious for some people, as cases rise in the UK and China. Health authorities have pinpointed 6 key signs of a relatively obscure illness, human metapneumovirus, hMPV, as cases surge across the UK. The UK Health Security Agency, UKHSA, has reported an uptick in hMPV diagnoses, coinciding with China implementing emergency measures to combat a spike in infections. The virus has predominantly impacted children, with social media posts depicting hospitals crowded with young patients exhibiting COVID-like symptoms. Human metapneumovirus is one of the viruses that causes the common cold and usually results in only mild illness. However, for some individuals, it can lead to severe health complications. The World Health Organization, WHO, explains that hMPV transmits in the same manner as other cold viruses, through respiratory droplets that become airborne from an infected person. This means a person can catch the virus when they are close to a sick person or sharing a closed space with them. The virus poses a greater threat to young children under 5 years old, the elderly, and those with certain health conditions such as immunosuppression, chronic obstructive pulmonary disease, COPD, and asthma, who are more susceptible to serious illness from hMPV. The UK Health Security Agency, UKHSA, has reported an uptick in cases of a particular virus. The latest figures reveal human metapneumovirus, hMPV, positivity increased to 4.9%, with the highest positivity in those aged 80 years and over at 7.3%. In total, around 7,826 specimens were tested for the virus. Symptoms. So what are the symptoms to look for? Most people infected with hMPV will have cold or flu-like symptoms that include cough, fever, sore throat, runny or stuffy nose, body ache, headache. However, it can develop into something more serious. WHO explains it can make a few people quite sick, causing infection of the lung, pneumonia, or inflammation of the airways to the lungs, bronchiolitis, bronchitis. Symptoms of more severe disease include wheezing, difficulty breathing, chest pain, dizziness, severe fatigue, dehydration, or a persistent fever that does not improve. If someone is experiencing any of these severe symptoms, they should seek medical advice. Due to its symptoms, it can be hard to distinguish hMPV from other respiratory illnesses. WHO adds, it is hard to tell different respiratory illnesses apart as they have similar symptoms such as fever, cough, runny nose, and congestion. However, the treatment can differ, especially for people who are or can become very sick. COVID-19 and influenza have specific antiviral treatment options. Doctors may use diagnostic tests to identify the cause before deciding on the treatment. There is no vaccine for hMPV, but you can lower your risk by wearing a mask in crowded or poorly ventilated spaces, improving ventilation where possible, such as by opening a window for airflow, cleaning hands regularly and thoroughly, with either soap and water or an alcohol-based hand rub, avoiding touching eyes, nose, or mouth without cleaning hands first. If you experience symptoms, you can avoid making others sick by staying at home if you feel ill, covering nose and mouth with a tissue or bent elbow when coughing or sneezing, wearing a mask when around other people, improving ventilation, especially in shared spaces, regularly cleaning hands and disinfecting frequently touched surfaces. You should be able to treat symptoms at home. WHO says, as hMPV is a cold virus, people can treat their symptoms with over-the-counter medicines to treat pain, fever, stuffy nose, and cough. Getting plenty of rest and staying hydrated also helps. Currently, there is no approved antiviral medicine for hMPV. Most people feel better in a few days. However, if symptoms get worse, you should contact your GP, and those who are at higher risk should also consult their doctor.